Good evening, Nigeria. Welcome to TVC News Politics on Sunday. I am Femi Akonde. The fallout of the by-elections held across the country continue to dominate conversations in Nigeria's political space. The political parties are also continuing with their bickering to outwit themselves. Well, President Bola Tinubu's cabinet will be 2 years on the 21st of August. Today on the program, we will not talk politics, but healthcare. Nigeria's healthcare under the leadership of Professor Muhammad Ali Pate as Coordinating Minister of Health and Social Welfare. The minister disclosed that from 2023 to date, nearly 50 billion has been disbursed directly to primary healthcare centers across the country through the Basic Healthcare Provision Fund with verifiable impressive results. And this has led to the qualitative modernization of health infrastructure across all local government areas of Nigeria. Let's hear him.
Vehicles that we are using in our effort to transform primary healthcare is the Basic Healthcare Provision Fund, which was established in 2014 under Section 11 of the National Health Act. The Basic Healthcare Provision Fund is an anchor for our sector-wide approach and provides funding for an additional resource base for subnational units, that is our states and local governments, to leverage upon in our collective bid to enhance access to primary health care across all parts of Nigeria. 2023 to date, more than 50 billion naira has already been disbursed directly to more than 8,000 primary health care centers across the country through the fund. And this has led to increase in the functionality of the primary health care centers, alongside many more ongoing PHC rehabilitation projects across all local government areas of Nigeria. More specifically, under the leadership of the President, the federal government is working with state governments through the IDA Impact Program to support the revitalization and upgrade of thousands of primary health care centers across all states and the Federal Capital Territory. This over the past 2 years. In fact, 37 million visits to primary health care centers have already been recorded in the first 3 months of 2025 alone, predominantly in our population living in rural and marginalized populations. This is coming at a time when, through the National Health Insurance Authority, NHIA, which is working with states and the private sector, has expanded enrollment nationwide by 4 million Nigerians to reach 20 million Nigerians covered for the first time in Nigeria's history. This added greater affordability and accessibility to the lowest income strata of our society, in line with the core tenets of the Renewed Hope agenda of Mr. President. So even as we upgrade facilities and enhance recruitment of primary healthcare workers, nurses, midwives, we're working to ensure that our people continue to effortlessly access the services that they deserve. We are unifying the Nigerian health sector under the sector-wide approach office led by its national coordinator, Dr. Muntaka Umar Sadiq, which has brought together civil society organizations, donors, states, local governments, and relevant federal institutions to drive one common agenda for development in the Nigerian health sector in a verifiable and transparent manner. We have equally recruited and trained a new set of young Nigerian leaders who we rely on to drive the future of our public health system, with each young leader emerging from a rigorous screening process. Our national health fellows. Every local government area of the country has now produced one young leader who will help us to drive the process of local accountability, quality assurance, as they help us supervise the operation of the upgraded primary healthcare facilities and the services that are being provided in them. At the tertiary level of care, of course, we are already trying hard to bridge the access gaps in the country, especially in the northern part of the country where there are huge gaps. And this is with the consistent support of President Bola Ahmed Tinubu, with whose support we have already executed more than 300 projects across 35 tertiary hospitals in the northern part of Nigeria, serving over 4.5 million patients in the outpatient department and 1.6 million inpatients in the northern part of Nigeria. Under the empathic and strong leadership of the President, Nigerians can and should expect that the total transformation of the nation's primary healthcare system is not only going to continue on course, but has already started manifesting tangible results, and there are real testimonies from Nigerians who previously did not enjoy access to the modern facilities.
Well, to give us better context is Dr. Agbo Ebuta. He's a consultant family physician and vice president medical initiative for Africa. Welcome to the program, sir.
Thank you, Femi, for having me.
Let's talk about the basic healthcare provision fund that provides a basic minimum package for health services in Nigeria. How significant or how robust now is this package, also in terms of its outreach and impact it's having?
Okay, so in 2014, basically the act came into place that gave the legal backing for funding that allows us to even talk about the basic healthcare provision fund, which is basically 1% of our consolidated revenue. So it's a first charge source of income, and the target of that is basically to grow and strengthen the primary healthcare. So what the minister or the coordinating minister was able to do this time around was to create some form of transparency by bringing in this fund in a basket and allowing this fund to be disbursed directly to primary healthcare centers. You have seen that at least 1,000 primary healthcare centers have been directly modernized. This means that they are able to provide a comprehensive, I would say, textbook type primary healthcare as it should be. But in addition to that, beyond modernization, particularly of 1,000 primary healthcare centers, what has also been achieved, especially in 19 northern states, for example, is at least, from the data we have, at least about 4,353 primary healthcare centers have benefited directly from the Basic Healthcare Provision Fund. Now, the Basic Healthcare Provision Fund comes from the federal government. It does not completely displace and addresses all the problem in the primary healthcare, for example. Yeah. So it is, as the minister has said it, and based on the frameworks we have, a sector-wide approach where you have a coordinating office that allows you to bring together federal government, state government, government at the local government level, civil societies organizations, and interventions from international bodies and NGOs who come up with grants that are specific for health.
Well, and is there data to back up the results yielding from these investments in the primary healthcare?
Absolutely, absolutely. There is data to back up that result. In fact, what we have seen is that the enrollment for people who are now accessing primary health care, access to primary health care has spiked, because in the past we probably had some challenge with data collection, but we do know that in the first 3 months of this year, for example, we saw a spike in access to health care at the primary health care, coming to as much as in the region of 34 million visits. Now, this is unprecedented, mainly for two reasons. First and foremost, we did not have the kind of data collection and ease of verification like we have on ground now. And then in the second part of it is that, of course, populations have increased. People can now access care at a subsidized level, mainly because there has been a frameworking of this access into what you know as a new National Health Insurance Authority Act, which has been fully deployed in some of these areas.
Well, despite the increase in enrollment in the National Health Insurance Scheme, Nigeria still falls behind. We're hearing about 20 million. Of course, that's an improvement considering the number that was generated, or the numbers that that the management or the authority was able to get registered within a very short period of time. But what's being done to improve engagement and also enlightenment to ensure that more people are captured? Because Nigeria still falls behind when you look at countries like maybe Indonesia, South Africa, and others, Algeria.
Well, the thing about it is that the current act came into place in 2022, was actually passed by the previous administration. But to operationalize it, you needed to come up with what you call operational guidelines, and that has now been put in place. And to deploy it, you need to set up the frameworks and integrate state governments into the whole plan. What we now have is that national health insurance is a mandatory thing for residents of Nigeria, and as I would say, Nigerians are lucky to have a chairman who, in the place of Senator Lorobi, who was part of the process of putting that act in place. So what the minister has also done, he has empowered and re-energized a new team of National Health Insurance Management who are driving the process. That is why I think it's unprecedented that in 2024 alone, what we saw was a spike of 2.4 million addition to that register. Now that has grown significantly to about 4 million in the last 2 years between August 2023 and this period. Again, it may seem to be like a scratch on the surface. It may seem to be not enough. But when you look at the trajectory in the past, that number, if we're able to sustain and double it, the number of people who can now access national health insurance through that framework will increase. What it does is that it takes off the responsibility of payment for services. You can walk into any accredited facility and you will get primary health care services. You will get basic health emergency care. You will get treatment for common health conditions like malaria. You will be treated, a pregnant woman will be offered basic interventions for delivery throughout her antenatal period. A young baby would be offered vaccination and every supportive care that is needed. If for any reason you need some form of specialized care, there's a framework that allows you to be referred along it.
Because I was going to ask, people complain about its limited treatment options.
Yes, indeed, there are concerns about those limited treatment options, but based on the feedback we have now, the scope of care has even been reviewed. It will shock you. But just recently, the information we verified or we confirmed was that even for cancer patients who were hitherto not covered by the National Health Insurance now get a subsidy in their treatment to the tune of 400,000 naira, if I'm not mistaken. And you do know that cancer care is a big issue, is expensive and requires significant resources. And the whole aim again is to protect Nigerians from catastrophic health expenditure. Health expenditure due to healthcare needs and challenges that can impoverish the patient in the course of accessing care.
We're also seeing some specialized cancer centers, being set up across geopolitical zones of the country.
Absolutely. So for most cancers would require proper diagnosis and treatment. In the diagnostic arm, you need histological diagnosis, and you also need what you call radio imaging. Radio imaging, the centerpiece of radio imaging are machines like CT scan, MRI, PET scans. These are heavy duty, running into billions. And once you are done with that, up to 50% of most cancers may be responsive to some form of what you call radiotherapy, radiation. So the use of specialized radiation to treat. Now, some of these equipments were not available to a large swath of Nigerians. So what the coordinating minister framework on the president's agenda for renewed hope has done, and what we've seen happen, is that they have partnered with the Nigerian Sovereign Fund, and at least on paper we have 10 centers coming up. In May this year, we had the pleasure of witnessing the commissioning of strategic centers in the South, where you had the University of Benin, in the Southeast, the University of Nigeria, my alma mater, and of course in the Northwest, where you had Katsina. The situation in Borno, where you had the flood issue, which caused a significant damage on the infrastructure there, I think is receiving attention, because we've seen the minister make significant visits to the companies that actually produce it, cutting out middlemen and reducing cost and increasing efficiency.
What has changed now in the health sector? Of course, the cabinet will be 2 years on the 21st of August, and that includes Professor Mohammed Ali Pate. Is it improved funding, or what really is that driving force in the sector that you'd say has brought up that upbeat and optimism that people now have confidence in healthcare delivery?
Well, I think one of the things would be that the president, in his wisdom, selected somebody who had significant international international experience and was able to reach out and leverage on that to a large extent. Because if you look at the kind of investments we've had coming, the European Investment Bank has put in $1 billion on the table. The Afrexim has also put in $1 billion on the table. And if you see that all of this has, in a way, stimulated the sector. But if you look at the trajectory, when the minister came on board, he had a 4-point agenda. He was talking about health security. He was talking about improving the leadership and transparency in decision making. He also talked about improving the health outcomes, the markers of health outcomes, and to a large extent, unbundling the healthcare value chain. But if you critically look at these 4 agendas, these are agendas that could not have come upstream all at the same time. You needed to put together a foundational agenda. And what were these foundational agenda? First and foremost was to create some form of leadership and transparency in the coordination of resources. That is where the sector-wide approach, a coordinating office that brought together national and subnational civil societies, organizations, and NGOs, also bringing their intellect and their resources on one table to allow for disbursement of resources. The second thing that I also did, obviously, was to come up with an executive order that reviewed how financing for health could happen, opening up opportunities for the private sector. And so what that did was that there was a significant investment in, for example, pharmaceuticals. It will shock you, but it shouldn't, that 70% of the drug consumed in this country is imported. Now, that shouldn't be. That's a lot of capital flight. Now, what the government is focusing on is reversing that trend and making sure that 70% of the drug consumed should be produced in this country by 2030. But what has really happened? What has happened is that with the executive order, with the policy like the Medipool, where government has now said that there will be a centralization of drug purchasing for health organizations that with links to government, so that you can have a pool of healthcare needs, have a funding which will come from the basic healthcare fund. So you have a guaranteed funding source. You have a guaranteed need base downstream where you have the health facilities are uptakers, but in between you have a group of health pharmaceutical organizations, private sector driven, who would now negotiate with government better pricing, guaranteed quality, ensure that there's sustainability and a structured logistics and a framework for delivery of medications. This whole arrangement, the Medipool arrangement, has driven interest in investment in Nigeria, because let us not forget, we are 250 million Nigeria. It's a 250 million population strength. One in 5 Africans is a Nigerian, and we dominate the West African space, and to a large extent is a huge market to invest in. So what the government is doing is to unlock that value chain.
And you talk about producing in Nigeria. The executive order signed by President Bola Tinubu, removed tax and tariff, provided tax and tariff waivers on importation of raw materials for pharmaceutical products. But there are infrastructure gaps. Some people say, we should first start with fixing these infrastructure gaps before allowing them to come in the raw materials now to be locally produced in Nigeria. And does it in any way also reduce the costs?
Absolutely. The thing about it is that it's the argument about, is it the egg or the hen that comes first, or is it the hen or the egg that comes first? So what is critical and important is that what has the executive order done? Recently there was a commissioning of a large case facility, first in its type, that has the capacity of producing 147 million test kits per annum. Now, these are test kits for malaria, test kits for hepatitis. Hitherto, we had to import all of these things, capital flight, exportation of job opportunities, as the case may be. So a company like Codex Bio, as named by the minister, had to come on board, and they saw an opportunity because of the executive order that they could invest sustainably. A company like the Jawa Investment recently came up with a significant facility for the local production of a medication like amoxicillin, clavulanic acid, and a couple of other high in demand medication, to a large extent. So we have seen what the executive order has done. It has opened up the market. It has guaranteed that you can invest. Government alone may not be able to build and manage industries. We do know what bureaucracy would do to those industries. So private sector, with some significant framework from government that allows foreign funding, has has kind of reawakened that market. So we do have, and then when you talk about tax waivers and tariff waivers for pharmaceutical products, equipment, and biologics, what that will do is that it will make our drugs that are produced in the country competitive. Because if you remove the tax, for example, it means for me, if I was going to produce a medication at 1,000 naira a tablet, and you've taken off tax and all of that and tariff, I can now produce that drug at 500. My profit margin of 200, instead of selling at 1,200, I would now sell at 700. And at the end of the day, the people in the market who need it, Nigerians, can access this drug at a cheaper rate. But guess what? That aside, with the Medipool in place, it means that there's a guaranteed supply and demand in place that government is overseeing. Now, we only need to put our eyes on those processes and ensure that they are not swept by misadventures and corrupt practices.
And I also believe, in a way, it would also help, reduce the issue of counterfeiting.
Absolutely, because now the process for entry into the Medipool would likely involve background checks about the competence of your company, the technical know-how of your company, your experience in the market, and all of that. And of course, companies who get on board will be afraid of giving or bringing counterfeit drugs, because if that is discovered, it will be a catastrophe for the company, because you'll be blacklisted and taken off the Medipool, and of course, the reputational damage will go a long way to put that company out of business. So it just allows a shift from what we have now, where anybody can get a license, import any drug, sell it at any rate to any government official or any government organization with little or no oversight. But against the background that the knowledge we have, that up to 65-70% of the drugs we consume in this country, in certain regions, for example, may have some problems with the standard because of how they are stored, how they are transported. Some of these drugs need to be stored at the right temperature in the right environment, but we do know there are infrastructural challenges. Now, these are some of the things that the Medipool, this kind of policies will resolve, because government can now insist that there's a checklist that partners in this policy must keep to, and it will drive investment, private sector investment in the process, and ensure that there's standardization.
One major challenge in Nigeria's health sector is the brain drain. And I know that the minister is also talking about it, concerned about it. But what are those deliberate efforts now to ensure that, yes, you can keep people down, but just to ensure that practicing in Nigeria is more attractive for our practitioners, healthcare practitioners?
Well, the thing about brain drain is that we must agree that brain drain is affecting every sector, mainly because, if you look at it critically, because of the exchange rate regime and all of that, if you were to move, some doctors tell you that if they move from Nigeria to the Middle East or any other part of the country, their salary doubles almost 10 times. That is significant. That's very competitive. But if you look at the purchasing power, again, there's some space you can tweak with around there. The Japa syndrome is not something that is going to be easy to push away. People would always continue to migrate. Even in the UK, people are migrating from UK to the US or UAE or Australia. But in terms of facts, and response, what the Minister for Health has done was to come up first with a policy. And what did this policy say? The policy said, look, we have a challenge with immigration. That reduces the pool of healthcare workers. How do we maintain that healthcare worker pool? So one of the things they did was, look, we are going to start training more healthcare workers so that we can feed in more healthcare workers to this pool. So they have doubled the admission quotas for most universities. So if a university was training 100 doctors, now that university has the clearance to train maybe 200 doctors. Now, over time, we're going to see those. We're not going to see those results immediately. It will take 6 years to train a doctor, 1 year as an intern, 1 year as a NYSC before you come upstream. So that is one, increasing the training spaces for healthcare workers. The second thing that the government, the minister was able to put together was that they came up with a policy to slow down the process. Now, part of that policy was to address things like rural healthcare workers, incentive for rural healthcare workers, so that, because apart from immigration from out of the country, we had internal migration. Exactly. So what they did was that, look, we are going to try to pay more to people who stay in rural areas. The second thing, obviously, was to review the amount of money people get at the end of the day. That negotiation is still on. There have been some front and back. There have been some proposition. Another thing that was also proposed, obviously, was to improve training, access to training, because access to training is kind of an incentive. A fourth thing that is being looked at and is being implemented, which we have seen, is improving the health infrastructure, improving opportunity to give world-class service, because some doctors are actually may not really be keen on leaving the country, but they want to be able to have that sense of fulfillment, provide the kind of service that can compete with anybody in the world while they are in country, for example. So for example, in cancer treatment sector, where they have increased access and infrastructure, and there's a lot of training going on, and the West African market is being targeted, there's a lot of tendency and incentive for people to stay back. But again, a lot has to be done.
Okay, but lastly, before we go on, that has to be, your response should be very quick now. You know, when COVID-19 came, it met a health sector that was not prepared for it, and it kind of crippled the whole pillars of the sector, and also made the country more vulnerable to some other preventable diseases. How is the minister now helping this sector build resilience and ensure that if there's another pandemic, well, the health sector is ready to withstand it, and all other preventable diseases are, properly handled?
Interestingly, that was the fourth agenda, which was about health security, building public health resilience, and increasing response capacity. Again, that has to do with building infrastructure, which is in place. That has to do with ensuring that there's a funding mechanism that directs funds directly to the healthcare sector or area where needed, like the primary healthcare center. That has to do with building the capacity for local production of drugs, which Medipool has created a steady need for supply, and this is now creating that investment, $2 billion in place, potential to increase to $5.6 billion in the next 2-3 years, and has increased interest in local production. That's why you have local production increasing by 147 million test kits per year, more production of local medications available. But we do know that these challenges cannot be overcome in 24 months. The minister has been there for 24 months, and the administration has just done 2 years plus. And we do believe that putting our hands together, all sectors, using the sector-wide approach where all sectors are, both government, non-governmental organizations come together, can give us better results.
Thank you so much. A fine place to leave it. Well, that's it on the program today. Our focus was on Nigeria's healthcare sector under the leadership of Professor Mohammed Ali Pate. Just within 2 years, and you say he's been able to achieve all of that, and Nigerians are still hoping for more. Well, that's it on the program today. You can see this episode again on TVC News YouTube channel. Well, up next is a documentary of President Bola Tinubu's Renewed Hope housing program.